Prime Cabinet Secretary Musalia Mudavadi assures Kenyans that the government has not signed any deal with Adani Airports Holdings Limited concerning the infrastructure upgrade at Jomo Kenyatta International Airport. The National Assembly Committee on Health is meeting with officials from the Ministry of Health to discuss the transition of the National Hospital Insurance Fund (NHIF) to Social Health Authority (SHA). The government flags off 67 Kenyan teachers who have secured job placements in various schools across the United States. Thank you for joining us once again. My name is Harriet Chimen. Our sign language interpreter is Walter Asere. Now, again, MP Elisha Odhiambo has pledged to advocate for the swift approval of Ugunja MP James Opio Wandaye and nominated MP John Mbadi's cabinet nominations. Commending President William Ruto's decision to nominate Wandaye and Mbadi to the Energy and Treasury dockets respectively, Odhiambo emphasized the potential for these appointments to promote national unity and cohesion.
To lead the President for appointing the Honorable Wandaye and John Mbadi as CSS in his government. I think this is a good indicator so that we have a more cohesive society, a more united Kenya, where all ethnic communities feel that they are part and parcel of the process. I personally, as the MP for Game, I'll be at the forefront to ensure that when the names of Wandaye and Mbadi are presented in Parliament, I'll ensure that the approval is done expeditiously, so that they can now concentrate and perform that task that the Republic of Kenya has bestowed upon them. The dockets that ODM members have been given are critical dockets. They are critical dockets that, if they use well, will change lives in communities. Mbadi CS Treasury is in charge of disbursement of monies to counties. ODM has been at the forefront for devolution. So it's up to him to live to the promise and manifesto of our party, to ensure that money is disbursed and that we can be able to re-strengthen the shilling, because it's going down. Initially it was picking up, but it's going down. And I think Wandaye's job is well cut. If you look at the survey that was done last year, energy sector, it is only in Nyanza that we have a coverage of electricity distribution of about 40-30%. In Central, they have 90, 98, 100%. It will help him now to ensure that constituencies in Nyanza get up to the level of where Nyeri is, where Kirinyaga is, where Othaya is.
Prime Cabinet Secretary Musalia Mudavadi has clarified that the government has not finalized any deal with Adani Airport Holdings of India concerning the sale of Jomo Kenyatta International Airport (JKIA). In a statement, Mudavadi confirmed that the government is currently reviewing a proposal from the Indian firm submitted in March 2024, which involves a 260 billion shillings upgrade of JKIA under public-private partnership. This agreement would see the project funded privately, with investors recouping the costs over time. Mudavadi emphasized that before any agreement is reached, the proposal must undergo stakeholder engagement and receive approval from the National Treasury, Attorney General and Parliament. The proposed upgrades include a new passenger terminal, refurbishment of existing terminals, a second runway, and enhanced cargo facilities. Kiambu Governor Kimani Wamatangi has disclosed a potential fraudulent loss of over 10 billion shillings linked to 3 companies tasked with revenue collection in the county. These companies allegedly deducted taxpayer money during transactions, promoting the committee to call for an Ethics and Anti-Corruption Commission investigation. Governor Wamatangi reported that the county has terminated its contracts with these firms and implemented a county-owned enterprise resource planning system to manage finances comprehensively. The Senate, led by Homa Bay Senator Moses Kajwang and Nandi Senator Samson Cherargei, is considering summoning the directors of the implicated companies as part of the ongoing investigations.
Also, which double up as the finance reporting systems that were not only faulty, erroneous, and intentionally, Chair, calibrated not to give accurate results. And so, and like I've said, because we are about to open the other reports, you'll see that continuously, there is no way, indeed, that there would have been correct reports when the mainframe of collecting that revenue that they're reporting on is erroneous, it's doctored, is altered to give results that were not supposed to be correct results. There are instances, Chair, when the county was running 2 systems at the same time, sometimes even 3 systems.
When we get this documentation, there should be possibility of inquiry, even summoning these companies, so that we get what were they really doing. It looks like it was a well-organized fraud that they have carried from 2014 until Governor Matangi came and terminated. And if there are officers within your administration who are culpable, Chair, then we can give directions as such that they should be surcharged to refund the money that was lost through these companies, even if selling the pound of flesh like in the Merchant of Venice.
Important matter, because you're talking about potentially 10 billion Kenya shillings, which should have been in those systems. And we'll be failing the people of Kiambu if we do not do justice to that matter. I think this will give rise to another session where we are looking at those documents, getting views from Auditor General, EACC. I think EACC, let's keep an interest on this matter, because it could be a quick win in terms of dealing with the people who have been fleecing the public. Because the sad thing is that, Governor, this is money that comes from the so-called hustlers. This should be, I'm not saying that any money should be stolen, but people say that the one that comes from the consolidated fund, afadhali ibiwe, lakini sio ile ya soko. Lakini walikuwa wanaiba ya soko, wanaiba ya kichinjio, wanaiba ya mama mboga. It is completely unacceptable.
The Health Committee has expressed concerns about the absence of a formal organizational structure for the Social Health Authority (SHA). This comes even as the authority is scheduled to assume control of health insurance operations on November 22nd. Currently, the SHA is relying on National Health Insurance Fund (NHIF) staff to carry out its activities. This dependency, they say, emanates from court cases challenging the implementation of the SHA, which have delayed the approval of necessary human resources instruments. As a result, the SHA is currently unable to recruit its own staff members. Let's listen in.
I wish to respond as follows. The Social Health Insurance Act number 16 of 2023 was ascended to on the 19th October 2023 and came into force on the 22nd of November 2023. It establishes the Social Health Authority and a framework for managing the social health insurance to give effect to Article 43, subsection 1A of the Constitution. The Social Health Authority took over all the functions and operations of the Board of the National Health Insurance Fund, NHIF, and the NHIF Board shall wind up the fund within 1 year of the appointed day, that is on the 22nd November 2024. The new laws aim to broaden the scope of the public health care, provide health care and financial protection to all Kenyan citizens and long-term residents, while also bringing about significant transformation in healthcare, financing, and administration. The submissions before you will answer the questions and the concerns raised in the letter, and will be glad that this engagement shall be fruitful and comprehensive with the aim of steering the healthcare ecosystem. As I mentioned, I've come with the members that were requested. They will be able to answer other subsidiary questions that will come from the floor, Chair. Below are the responses and submissions to the questions raised as per the letter dated above. Chair, you asked what are the terms of the reference for the Transit Committee from the National Health Insurance Fund, NHIF, to Social Health Insurance that SHA, the Human Resource Transition, Pension, Redundancy and Recruitment of New Staff, and in response, Honorable Chair and Honorable Members, the Transition Committee was appointed pursuant to the Gazette Notice number 603 of 2024, dated.
Well, be sure to get a detailed update on that story later on. Elsewhere, over 8,000 households affected by the Kenyan flood disaster between December last year and May 2024 are now calling for permanent relocation to higher grounds. Residents are urging the government to establish comprehensive sanitation facilities in the camps set up during the floods. Ventura Kwamboka reports from the Tana Delta, where the need for lasting solutions is becoming increasingly urgent. Floods are a recurring nightmare for the residents of the Tana Delta, forcing them to seek refuge on higher grounds time and again. The temporary camps, often set up in bushy areas prone to wildlife dangers, lack of proper sanitation facilities, exposing families, especially women and children, to waterborne diseases like malaria, typhoid.
Hapa mali tumekaa inaitwa Dumi. Na hapa ndo tunachukua kama center. Huko nyuma kuna makambi tofauti. Kuna Malalo, kuna Ziwa la Buya, kuna hiyo Matomba, kuna Dumi, kuna zingine huko Kivukoni. Sasa tulipokuja hapa tulipata tabu sana. Mambo ya afya. Janga la mafuriko lilipoingia, watoto waliathirika sana kwa sababu ya baridi. Baridi kali, ile baridi iliwaumiza sana. Na pia vyakula havikuwa vinapatikana.
Hasera Dado from Dume village knows all too well the dangers of waterborne diseases.
Tumekuja tu na matambara tu ya canvas ambazo ni za kitambo sana, zimeoza. Mvua siku hiyo imetunyeshea kuanzia saa 11 mpaka magharibi, kaelekea mpaka saa 2. Tuliteseka sana. Mzee akaja kagonjeka sana, mpaka ameenda kwa maji huko. Mtoto pia naye aliharisha sana. Nikadhani ni kipindupindu, nikamchukua hapa akakimbia naye asubuhi sana, nikaenda naye hospitali Garseni kwenda na.
In response to these health threats, the Kenya Red Cross Society has implemented programs aimed at preventing waterborne diseases. They have supported 6 health facilities to conduct screening and mapping out disease hotspots, helping communities access critical medical care despite high cost and remote locations.
We've been able to support life-saving interventions in the health sector, just to ensure that communities that have been displaced, that are not able to access health services, also that have compromised public health facilities such as latrines and hygiene promotion, and sanitation facilities, have the necessary interventions to address those disease prevention actions.
Life in the camps remain tough, with a constant threat of wildlife and poor sanitation. Many of the displaced residents, who have had to move twice due to floods since last December, are demanding a permanent relocation solution to safer areas.
Huu ni mwaka wa 10. Kila mwaka tunatoka, maji yanakuja, sisi tunatoka. Maji yanakuja, tunatoka, tunakuja, tunakaa, maji kikauka, tunarudi. Hiyo ni shida ile ambayo tunaipitia. Serikali kama wao wamechukua ahadi watalinda mwananchi yeye na mali yake, inafaa watupatie makao ya kudumu. Ndio itakuwa suluhisho peke yake.
In the March, April, May disaster period alone, over 600,000 people were affected by floods nationwide, with more than 300,000 displaced. In Tana River County, over 10,000 households were affected, with 8,300 of those in Tana Delta alone. The need for a long-term solution to these recurring floods is clear, as residents continue to hope for government intervention. Ventura Kwamboka, K24 Newscast. Well, meanwhile, Kenya's population is projected to reach 70 million within the next 5 years, according to the National Council for Population and Development, NCPD. As the country experiences rapid growth, especially in urbanizing areas like Ruiru, planners and policy makers are being urged to consider factors such as urbanization, fertility and age structures in their planning and service provision. NCPD Deputy Director for Public Education and Advocacy, Jen Wanjaria, emphasized the need to account for population dynamics, including fertility rates and mortality, to ensure adequate service provision such as hospitals and water supply.
Life expectancy is going up because like currently we are having women are living about 67 years on average, while men are living an average of 61 years, which is an improvement from the previous census that we did in 2009. I think biologically and also demographically, men are exposed to more risky factors, especially the type of work they do. And if you look at even the jobs they take, they are more riskier than the jobs that are taken up by women. And this could be the reason why maybe they are exposed to death earlier than the women. We are talking about environment, we are talking about migration, we are talking about fertility, migration. All those things actually are factored in when we are doing budgeting, because again, we may not be able even to budget if we are not considering population as a key influencer in budget making. We are saying that by 2025, the Kenyan population will be about 70 million.
Well, on that note, we take a very short break. More stories to come. Do stay with us.